Brecht, Cardoen, if we would like to have this on a broader scale in Europe, what do you still see as barriers?
Frankly, I think also the financing system can be an incentive to get it done more quickly in some countries than in other countries as well. But it also brings me back to bringing things outside of the hospital. This is, I believe, for hospitals that run under a fee-for-service system, so per act you also get paid for that, they will not really like that. And if you bring things out of the hospital to private clinics, really outside of a hospital, they will also lose means of budget in order to support other activities. And then you get hospitals that, of course, are more acute, more difficult cases, stay in the hospital, but then also the financing system should follow. And there, so to scale the idea and the many advantages I think there are from going outside of a hospital as well, it also depends on how it is supported, again, through the financing system. So that hospitals don't really lose from doing that. Also, they need to foster it, and they need to support that some activities perhaps should take place in a more controlled, easier setting, if you wish.
But probably the situation is completely different in many parts of Europe. We are here in Brussels. There are 5 academic hospitals in Brussels. So if you are performing ambulatory surgery, it's possible if there is a side effect or a problem after the surgery, the patient will always find someone to help him or to help her in the 24 hours after the surgery. On the contrary, if you are in the south part of the Belgium, it will be more difficult to find an hospital probably for her or for him. So I think that the geography is important.
Dr. Leunig, how about the financing? Is that an issue between hospitals and private practice?
I think, yeah. I mean, this procedure should be manageable and having their reimbursement. I mean, in Germany, there's not a big difference in reimbursement between the big hospitals and the private sector. Of course, the private insurances are paying more than the non-private insurance, and this may be an influence on building up this kind of ambulatory settings to treat the patient. So yeah, I mean, reimbursement is a issue, and if you don't have the money, you can't run it like this.
Dr. Prokopakis.
The question is about the finance. In my country, the public sector is a huge sector, so there's no really difference between the amount of money the companies pay for a procedure undertaken under private or in the public hospital. But I think that in the next few years this will change, and procedures in private sector would be less expensive than they are now, especially if they will be undertaken under local anesthesia.
Dr. Hopkins, is money an issue in the UK?
Absolutely, I think money's an issue everywhere, and we are all under pressure to deliver healthcare for less money. We have a growing and ageing population. So a model that supports cost-effective care is definitely a good thing. As I said,
and do hospitals see this as competition?
Well, the NHS is a monopoly on healthcare in the UK, so we have very little private practice. So this would be a tool for the hospital to deliver care within its setting at a lower cost, but still within the hospital itself.